So our next speaker is someone who is very well known at the AU, Dr. Agnes Akosua Aidoo, from the National Partnership for Children in Ghana. Now, Dr. Aidoo has been a member of the UN Committee on the Rights of the Child and served as the committee vice chairperson and rapporteur. While we are waiting for her, Dr. Aidoo, her whole biography is in our document, and please read it. Just to also say that Dr. Aidoo holds a PhD in history and social anthropology from the University of California at Los Angeles. So we are really looking forward to hear your contribution here in breaking the ice for this topic. Thank you, Dr. Aidoo.
Thank you so much. Your Excellencies, distinguished all protocol observed, dear colleagues, the adoption in the last decade of social protection in Africa and the existence of good examples in several countries are a welcome development in our continent. I take the opportunity to congratulate the African Union Commission, in particular the Department of Social Affairs, for promoting social protection as a key part of Africa's social policy agenda. So much has been said from the opening dinner last night and already this morning that we really need to move forward and cannot repeat. What I think I want to do first is to acknowledge and add my voice to the recognition of the significant progress that has been made by several countries in social protection so far. Then I will quickly recall some of the challenges. We will hear about challenges all through this meeting, I'm sure. Some of the important aspects of the challenges that perhaps are often kept in the background, but which I believe, from a broader perspective of social development, social policy, and Africa's development, we need to constantly recall. And then at the end, I'll share a few thoughts on how I think a deeper focus on children's rights could give opportunities to improve and expand the vision, design, and implementation of social protection in the continent. On the challenges, first we should acknowledge that social protection is both a human right and sound economic policy. It should be part of the priorities and contribute positively and progressively to the socio-economic transformation of Africa envisaged in the AU Agenda 2063, the future we want for Africa. For children's rights, the moral and legal frameworks have already been established by the ratification of by virtually all African states of the Convention on the Rights of the Child and the African Charter on the Rights and Welfare of the Child. Now we are remaining with only 7 member states of the African Union to complete the ratification of the African Charter, and we look forward to the day that we can celebrate the 54th state's ratification. All states parties are making commendable efforts to implement their obligations under these treaties. However, the monitoring that has been done and continues to be done by the UN Committee on the Rights of the Child, on which I had the privilege to serve for nearly 7 years in Geneva, and by the African Committee of Experts on the Rights and Welfare of the Child, it is clear that the majority of children are facing various challenges that undermine their rights and dignity and curtail their ability to reach their full human potential. Now, to highlight some of the aspects of the broad challenges, I'd like to note the demographic challenge, which must be part of our big canvas when we are designing our programs. Then the challenges that are fundamental to the rights of children to life, survival, development, protection, and the perennial problem of limited fiscal space and financial constraints. All these challenges affect the scope, efficacy, and scale of social protection in the continent. On the demographic challenge and imperative, UN data shows that in 2010, children and young people from 0 to 19, they didn't give 0 to 18, they give 017 and 019, but there are other data as well on 0 to 18. But the UN ones I find very informative. Children 0 and young people 0 to 19 constituted 51.6% of the total population of Africa, or 532,289,000. Eastern Africa and Western Africa have 55.5% and 54.2% respectively. Now this compares to 40.9% for South Asia and 37.3% for Latin America and the Caribbean. At the same time, the child dependency ratio of children and young people 0 to 19, these children per 100 population aged 20 to 64 was 114.9 for Africa, 126.2 for sub-Saharan Africa, again compared to 75.4 for South Asia and 66.7 for Latin America and the Caribbean. So, demographically, Africa is not only the youngest region in the world, but it has also the largest dependent child population. This requires that children be placed at the center of Africa's development strategies, including social protection. The future we want, which the AU has declared, must clearly be a future for these overwhelming children and young people. Now, on the challenges, I like to highlight a few aspects. Now, considerable achievements have been made, and we will hear about them in legislation, in social policy, children's policies, and so on, and improvements in child health, child education throughout the continent have been notable. But the rights to life, survival, and development, Article 6 of the Convention, are severely threatened by disease, HIV and AIDS, malnutrition, and lack of education. At present, the under-5 mortality rate, well, in 2011, the under-5 mortality rate of 109 per 1,000 live births in Africa was the highest in the world, compared to 62 in South Asia and 19 in Latin America and the Caribbean. I make these comparisons with other developing regions just to spur us on to take on the big task ahead of us in the league of the developing world. We've heard a lot about poverty, and poverty definitely threatens and undermines the rights of children to survive and develop and to thrive. Now, studies by the African Child Policy Forum and others have shown that child poverty is reducing at a much lower rate than overall poverty, partly because comprehensive child policy has not been given the required priority in most poverty reduction strategies. Now, besides continuing poverty, and especially for children, there is growing inequality in the region, which affects children's rights. Data from UNICEF's 2013 State of the World Children Report indicate that inequalities at the household level are stark. 40% of households with low income in sub-Saharan Africa receive only 15% of the total household income, while 20% of households with the highest income capture 50% of household income. The disparities in household wealth have severe impacts on children's rights in different areas. For example, in 2007-2011, the underweight prevalence in children under 5 was 30% in the poorest 20% of households, compared with only 12% in the richest households. The primary school attendance ratio in the same period was 53% in the poorest 20% of the households, and as high as 80% in the richest 20% of households in sub-Saharan Africa. Now, these, again, I suggest, must really be part of the canvas on which we are drawing up our programs, country-wide or region-wide. The rights to social security, Article 26 of the Convention, and to adequate standard of living, Article 27, and the corresponding articles in the African Charter, are denied to most children in rural and urban areas, as well as to children with disabilities, children living in the streets, orphans, and children with other vulnerabilities, a matter on which the Committee on the Rights of the Child has consistently drawn the attention of African states. Now, the limited fiscal space and financing. We've heard a lot about it, and we'll continue to hear a lot about it. But it's clear that the recent economic growth in Africa is not translating well enough into concrete results in terms of reducing inequality and expanding the fiscal space to invest in children. Again, ACPF's report, the African Report on Child Wellbeing 2013, towards greater accountability for Africa's children, shows that the wealth of many countries does not necessarily translate to child friendliness or child well-being. Several countries with relatively high GDP per capita, we could mention Equatorial Guinea, Gabon, Namibia, Congo, Brazzaville, and Angola, are investing less than countries with relatively low GDP per capita, such as Rwanda, Lesotho, Togo, and Malawi. What seems to matter is political will and determination, not necessarily the volume of resources. And here I'd like to remind that Article 4 of the Convention on the Rights of the Child states enjoins state parties to spend, and I quote, to the maximum extent of their available resources, on measures regarding the economic, social, and cultural rights of children, and only when necessary should they resort to international cooperation. Social protection, in my view, and its related child protection programs and interventions should be treated as necessary core costs of development in Africa, and not tangents to it. Africa is nothing but its people. Africa is nothing but its children and youth. We must commend and learn from countries like Kenya, Zambia, South Africa, and Ghana that have increased national budgets for social protection programs. We should really make sure that affordability does not become an excuse for inaction in social protection. Now, when we look at the child rights, children's rights, and the opportunities to enhance social protection, I'd like to highlight a few. I think a children's rights approach should help to define or refine a broad vision of social protection as a right for all children and their families that is realized progressively, starting with the most disadvantaged, vulnerable, and excluded. It is important that this broad vision of social protection for all is held not just by the policymakers and implementers, but also by the beneficiary families, communities, and children themselves. This may require appropriate public education and awareness raising, but such a participatory approach in defining or refining the vision of social protection in particular contexts should help to avoid two things: stigmatization of beneficiaries of social protection interventions on one hand, and also social stratification and political risks on the other, where only the poor benefit and other segments of the population pay into social protection programs and systems and get nothing in return. We have to watch the ground on how to balance the interests of all the segments of our populations. Another aspect is to a focus on human rights and children's rights should help social protection to do is to contribute to social and economic transformation. This is what the African Union is saying and is looking for. We want a transformation in this continent, socially, economically, and so on, politically. The families and communities and children that are empowered through child-sensitive social protection must be enabled to participate effectively in the creation of the vision of the future and in the development of social and economic policies and their implementation. They must have a meaningful voice in their own development and all other development that affects them. For children, this will be implementing Article 12 of the Convention and on the right of the child to express their views on matters that concern them and have their views given due consideration according to the children's age and maturity. Now, another area, I'll be done in a minute, that I like to draw attention to with social protection making a contribution is, would social protection activities enable the empowered families and communities to deal with the social and cultural attitudes and practices that are harmful and make children vulnerable? Social protection must tackle some of the root causes of vulnerability. Attitudes leading to intra-household discrimination based on age, gender, and disability cause vulnerabilities for adolescents, girls and children with disabilities. Harmful practices such as attacks on albinos and twins, FGM, child marriage, and forced child labor, especially in the worst forms of child labor, are underlying causes of vulnerability for large numbers of our children. And can social protection, so far we don't see much in the experience that is coming out that social protection activities are directing themselves to the root cause issues of the vulnerabilities. Will it be a lost opportunity to leave these issues to the child protection sector and not to engage in a coordinated and synchronized approach between social protection, child protection, and other interventions so that we can get greater, more effective, and more sustainable results? I'm glad Ambassador Olawale Maegun referred to the need for synergy between social protection and child protection. Now, all children's rights are interdependent and indivisible, and their realization requires such multisectoral, multidisciplinary coordination. My last point, sir, and I do apologize, is that if we could, where possible, take a life cycle or a life course approach to social protection, we could cover more effectively and more efficiently different segments of the population, including the child population, especially adolescents who seem to be left out in many of our programs, and we need to take a good look at their specific needs in health, education, personal and lifestyle development, and their need for a voice and appropriate participation in family and community affairs. South Africa's experience with the Child Grant Scheme has already done a lot for adolescents. We saw examples of that last night, and I think we could all learn from this. In conclusion, sir, the realization of children's rights should be an ongoing process and commitment within the development agenda of all African countries. The overwhelming number and percentage of children and young people in the total population and their heavy weight of dependency on families, households, and communities make it imperative to consider children as major constituents of development and to put them at the center of our development agendas. I also like to say that since our society is so far highly inequitable and millions of children are being left behind, we need to find ways to develop rapidly expanding, deep programs in social protection and other social development areas to give opportunities to these children who are left out to participate. Social protection strategies must be based on holistic, human rights and child rights perspectives. They must be progressive, expansive, and their implementation must be accelerated. In my view, small, slow, incremental approaches to social protection would risk leaving too many children and their families behind for too long. I thank you.
Thank you very much, Dr. Aidoo. I wanted to say, I told you so. She really knows this area very well, and that's why we also lean strongly on her recommendations. Dr. Aidoo, please could you also give your presentation to the back? Thank you, so that we can already note down your recommendations there. Thank you for your presentation. We appreciate it.